Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens. Join me, Dr. Tarryn, and health expat Emma as we explore delicate subjects related to the women's health space. We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends, let's begin.
How's it, Cha?
Hey, Em. How are you?
I'm good. I feel like I haven't really spoken to you in a very long time. I miss you.
Oh, my monk. I miss you too. How are things in France?
Good. I am finally in my new apartment, so you can see I have a different background here today. It's been a pain in the neck to try get in here, but I'm in. And I'm super happy to be here, and also very happy to be here with you today to talk about endometriosis.
Yeah, this is a really big topic. And actually, I must draw the attention of our listeners to the fact that we actually have done an episode on period pain, right? The bloody hell periods. And in this episode, we definitely introduced the topic of endometriosis, but I just love the fact, Em, that you suggested that we hone in on this condition specifically because it really deserves the spotlight. 1 in 10 women suffer from endometriosis, which is like a crazy, crazy fact. And we'll talk about it, like the whys and why is it so underdiagnosed and mistreated. There's so much to talk about. But before we do, I just wish to state a very quick disclaimer, and that is that although I am a qualified medical doctor, this podcast does not serve to offer any personal medical advice. So always seek the advice of a healthcare professional with regard to any condition or treatment you may be seeking.
Just from my side, this podcast doesn't reflect any of the views of the company I work for, and these views are solely our own. So with disclaimers out of the way, let's dig in. What is endometriosis?
Endometriosis, Em, is a chronic, benign inflammatory disease that typically affects women across the lifespan, although usually it affects women in their reproductive years. And basically what happens is that you have the endometrium, which is the lining of the uterus. And typically with every menstruation, that endometrium thickens and a girl menstruates. Now, in the case of endometriosis, what happens is the endometrial lining is almost displaced and it starts growing in areas outside of the uterine cavity, in places where it shouldn't be. So, for example, the fallopian tubes, or near the ovaries, or around the abdominal cavity in the pelvis. So when this tissue grows there, it is highly responsive to its hormonal environment, and it can flare up, and essentially it can trigger inflammation and a whole range of symptoms, which we're soon going to explore. So that's in a nutshell, very simple terms, what endometriosis is.
And before we do dig into the symptoms, do we have an idea kind of what causes endometriosis? Understanding what comes up? I mean, you mentioned 1 in 10 women have endometriosis. That's a pretty crazy statistic. Do we have an understanding of what is actually causing it?
So that's the $1 million question, Em, because the short answer is no, we do not. And it's just crazy. Like a disease that affects 1 in 10 and we have no answers. There are certain hypotheses which have actually been disproven. But the one hypothesis called retrograde menstruation states that if a girl menstruates, sometimes, unfortunately, some of the menstrual blood kind of seeps back into the tissues, and it lodges there and then kind of stays there. But this has been disproven because retrograde menstruation is actually a phenomenon that has been detected in many menstruating women who subsequently have not been proven to have endometriosis. So we can almost do away with that hypothesis. But it's a nice one to think about because it further lays a foundation to our understanding as to what this condition is. Because remember, when you menstruate, the endometrial tissue bleeds. But if it's got nowhere to go, this is what triggers inflammation and pain, right? So I just think it's like a useful way to think about it, the symptoms that we'll delve into.
So let's do that. Let's delve into the symptoms. I know you mentioned one, and I think that is the one that's most commonly associated with endometriosis is pain, right?
Yes.
And really severe pain at the time of your menstrual cycle, extreme cramping. But tell me more about the symptoms. What should you be watching out for? What is kind of that checklist that a doctor would go through to say, hey, this could be endometriosis?
So the symptoms of endometriosis are so mixed. And this is actually one of the reasons that accounts for why so many women underreport their pain and go misdiagnosed with the condition, because they don't even put two and two together to think, oh, this symptom could perhaps be endometriosis. So let's go through them. So dysmenorrhea, otherwise known as painful periods, this is the most commonly reported symptom. But where it throws patients off a bit is that it can actually occur when a girl is not menstruating, right? So dysmenorrhea is during the periods, but you could also have chronic pelvic pain outside of the menstruation for the reasons that I mentioned earlier, that the tissue kind of flares in response to hormones. So that's the main symptom, but then you have others like dyspareunia, which is painful sex, especially if the endometrial tissue kind of lodges deep in the pelvic cavity. It can trigger very painful sex. And then heavy menstrual bleeding may or may not happen. You also have infertility, which we're going to delve into later. A lot of women actually have asymptomatic endometriosis, which only subsequently gets picked up when the workup is done for infertility. Other commonly reported symptoms are bowel and bladder dysfunction. That's if the endometrial tissue lodge around the bladder or the bowel, places where they can go. So this would manifest in symptoms like pain, urgency, frequency when it comes to the urinary tract, and then constipation or rectal anal pain if it's near the rectum. Very rarely, it can also even manifest as chest pain because, yes, you thought it, the endometrial tissue can actually enter the thoracic cavity. I mean, this is very rare, but it can happen. There have been case reports of this. And then there's also like the non-specific symptoms like fatigue, especially if you're bleeding heavily as a result of the endometriosis. You're losing lots of iron, fatigue. You could have non-specific lower back pain. So yeah, I would say those are the major ones to look out for.
And did you say that you bleed more heavily? Sorry, is that also then a symptom that you would bleed more heavily with endometriosis?
It is a recognized symptom, but some girls with endometriosis don't have heavy menstruation. So it's not limited to endometriosis, but it can be a reported symptom.
Okay. And I've heard also that some people also suffer from like leg pain, sciatica as a result of the trapped nerves because of the back pain and stuff like that. So that's one of them. And also a lot of bloating, right? So I've seen a lot of videos lately where people are speaking about endometriosis, and I don't know, I feel like it's definitely getting a lot more visibility and people are speaking out more about their endometriosis, but a lot of the times these videos are kind of centered around also the bloating elements of endometriosis, and they're like, we eat right, we exercise, doing everything, but at the end of the day, that also part of it, a digestive issue?
Yes, this would absolutely make a lot of sense, especially when we look at the breakdown of the pathophysiology. So, the fact that it's a chronic inflammatory disorder. So when the body's in an inflammatory state, yes, it will manifest as bloating, gut issues. More and more research is now going into the role of the gut and endometriosis. So there's a lot more to explore there.
And from like a personal narrative, I mean, I don't have endometriosis, but when I was diagnosed with PCOS, funnily enough, actually my doctor kept asking me that, do you have pain? Do you have pain? Mm-hmm. And a lot of it was kind of asking that to, I think, rule out endometriosis. Mm-hmm. I know this is a bit of a tangent, but is there kind of similarities in PCOS? Because I know we've spoken about that in a previous episode.
Yeah.
And that has quite an extensive checklist, and I imagine on the scans that would present quite differently than endometriosis. But are there kind of overlaps, which I think takes us also then nicely into the how is endometriosis diagnosed, right?
Yeah. I mean, the two are considered separate conditions, but having said that, they can most definitely be overlapping symptoms. Typically, one thinks of the whole irregular periods or absence of periods with associated features of hyperandrogenism, so like the high testosterone states, that's kind of like linked to PCOS, whereas the painful periods, that's more linked to endometriosis. But having said that, many girls with endometriosis don't report strong, heavy period pains, and they have endometriosis, and this is picked up when they worked up for their infertility, and both conditions can actually manifest with that. So yes, absolutely, there are overlapping symptoms, and definitely if you're concerned, it must be worked up by a doctor.
Let's just actually tackle that, the fertility aspect. Why why is endometriosis an issue when it comes to fertility, and then we can kind of unpack ways to look into that, ways to mitigate the impact. But just to understand a little bit, because you've mentioned it a few times, just what is the impact on fertility?
Absolutely. So I don't know exactly the percentages with regard to, what percentage of girls with endometriosis subsequently suffer from infertility. But what I can tell you are the proposed mechanisms underpinning infertility in cases of endometriosis. So basically, it really depends on the stage of disease. So in mild, moderate cases of endometriosis, the hallmark of this condition is the inflammation that I spoke to earlier. And basically, this triggers inflammatory immune cells, right? So cytokines, natural killer cells, immune mediators, which then essentially launch inflammatory reactions towards this ectopic endometrial tissues that's found in places where it shouldn't be. And this inflammation, if it happens around the ovaries or if it happens around the tubes, it can affect ovulation, it can affect endometrial function. But then in cases of more advanced endometriosis, when you've actually got fibrosis or adhesions, scarring of the tissues as a result of all these inflammatory reactions that's occurring chronically at a large level, this can actually distort the pelvic cavity to the extent that even if ovulation is not impaired, fertilized egg would actually struggle to make its way through the tubes, which are blocked essentially due to the endometriosis, and implant in the endometrial cavities. So that's basically the proposed mechanisms, which is dependent on the stages of disease. And yes, I mean, all of this can be mitigated. It just has to be detected, right? During the infertility workup, a doctor will check the patency of the tubes if it gets to that stage in the workup. And maybe patients might require assisted reproductive technologies like IVF. So this is not to freak everyone out. There's definitely treatment available, but it is a recognized cause of infertility.
In France, actually, they provide egg freezing for girls with endometriosis as a way to manage the impact that this could potentially have on one's fertility. Women with endometriosis do get onto the list faster for egg freezing.
South Africa, are you listening? Please, let's do the same. Wake up. It would be amazing if we could offer our patients that. Oh, the dream. Yeah.
And definitely, we've also done an episode on egg freezing. So if you are listening in and you haven't heard our egg freezing episode and that is something you're interested in hearing more about or learning more about, then definitely do check that out. But Tad, tell me a bit about how endometriosis is diagnosed. What are you doing in terms of, you obviously have your symptoms. You probably have a reason why you're going to the doctor, right, for these symptoms, I would imagine. How is it diagnosed? And then it would be also really good to understand, why is it so misdiagnosed?
So basically, how is it diagnosed? So yes, on symptoms. I mean, if the symptoms are suggestive, patients are coming in, for example, with debilitating period pain, you can make the diagnosis almost preemptively, but sometimes it's nice to have confirmatory ultrasound scans. So basically, the next step would be a transpelvic ultrasound scan. And the ultrasound may or may not show an endometrioma, which, if it does, is highly suggestive. Okay, there you go. There's your diagnosis.
An endometrioma, again, is that scarring, right?
So the endometrioma is actually the endometrial tissue that's kind of confined itself to the ovary. And if a doctor or an ultrasonographer sees that, then it's highly suggestive of a diagnosis of endometriosis. But I'm really glad you asked that, because remember, endometriosis can implant anywhere. So it could be the case that it's implanting behind the uterine cavity, in the abdominal cavity. I mean, it's very difficult to detect on ultrasound. So if you have a negative ultrasound scan, it doesn't mean that you don't have endometriosis. And this is why it makes diagnosis such a challenge, because up to date, there is no one reliable blood biomarker that says, hey, you've got endometriosis. It's crazy. We cannot detect it on the blood. So for this reason, I think it goes very largely undetected. And it can take a girl up to 7 to 8 years to get this diagnosis, because the only way you can really truly say that you have endometriosis in the absence of having seen an endometrioma is to go in with surgery. And that is often what happens. If a girl fails the first and second line treatments, a doctor then has to go in surgically, put a camera in laparoscopically, to take the tissue and then biopsy it and confirm a diagnosis of endometriosis. So to date, that's the gold standard. So And there's many reasons why it goes largely underdiagnosed. Everyone experiences pain differently, right? So my subjective experience of pain is different to yours. So I might be vomiting with pain in the bathroom here, and I'm like, no, it's fine. It's normal. This is normal. Because a lot of girls have also been gaslit by the medical community. I mean, I actually think the medical community is largely responsible for this problem. They tell the girls, no, it's fine. You're okay. They're not okay. They're suffering. They're missing school. They're missing work. So there's that. And then there's the fact that we don't have the blood biomarkers, which makes diagnosis a challenge. And then there's also a large list of differentials. So other alternate diagnoses that can manifest in similar ways. So you could come to me with all those symptoms. I could say, oh, you've got IBS, or you've got pelvic inflammatory disease. There's some symptom overlapping there. Or you could have a recurrent UTI, urinary tract infection, which can kind of cause a similar type picture. So large list of differentials, no blood biomarkers, subjective experiences of pain, and gaslighting. These are my main reasons to account for why it is so misdiagnosed.
And if you are somebody who is suffering with endometriosis, or you suspect that you're suffering with endometriosis, I know we've spoken about menstruation before, but what is normal? Let's just kind of recap that a little bit. If you are suspecting, you say that, yeah, maybe I get pain, or there are certain things that are happening, where and when should you go to your doctor and basically say to them? Because unfortunately, I think in today's society, you said a lot of it is, there is gaslighting. I appreciate that you doctors are doing the absolute best you can and seeing a lot of patients and doing really, truly admirable work. But I think there is still a lot of onus on the patient. And I think especially as women, there is also a level of misunderstanding certain things. And I think pain, especially when it comes to women, is also, as you said, very misdiagnosed. Oh, it's a woman, whatever, or, she can, what is normal? What should you be thinking about? But what would you say is considered normal and versus abnormal?
The only way to answer this is really to say, if it's affecting your quality of life, it's not normal. You can't go to school, you can't go to work. The pain is out of control, and it's really affecting your ability to just get about the day. Then I'd say go and get it evaluated. If it's like a bit of a cramp here or there, you take an anti-inflammatory, it goes away. It's probably okay. If in doubt, still consult. But it's usually the pain that actually keeps you from work, school, university, etc. That's problematic.
And so what can you do if you are diagnosed? What treatments are available? Is there anything with regards to your diet, your exercise that you should be considering?
Good questions. Okay, so let's start with medical treatment, okay? So it works in a step-up approach. You first manage the symptoms. So if you've got pain, you might be prescribed an anti-inflammatory, and you take it from there. But typically girls require more stringent control of their hormones, because this is all in response to hormones, right? So if you could kind of keep the hormones at bay, you can hopefully keep the symptoms at bay. So the algorithm also really largely depends on whether a girl is desiring fertility or not, because you have to factor that in. If a girl's trying to conceive, well, you can't give her hormones. You're going to have to think of another creative way. But for those girls that are not wanting to conceive, we prescribe the estrogen progesterone contraceptive, otherwise known as the combined oral contraceptive pill. And this is thought to suppress ovarian function, just keep everything quiet so that there's no flare-ups happening. It's also good for menstrual regulation, so it serves other purposes as well. And it may offer symptom support. But in those cases where it doesn't, like the pain just doesn't go away and the pill's just not doing it, then you can step up the treatment, and a doctor might prescribe a progestin-only treatment, which is thought to confer stronger suppression of the hormonal pathways. So progesterone-only treatment comes in different forms. So you could also be prescribed a progesterone-only pill. There is a certain kind of pill that can be given, which at very high doses suppresses the estrogen, because at the end of the day, endometriosis is an estrogen-dependent condition. So it basically thrives off estrogen. It grows off estrogen. And
that's what's causing the flare-ups too then, right?
Yes,
so if there's probably a surge in estrogen for various reasons.
Yeah, absolutely. So you want to kind of keep the estrogen down and the progesterone up. That's like the idea.
Quick question with regards to the pill, because you mentioned obviously it helps to also suppress. can it also suppress symptoms on like a scan or something like that, that can also create that misdiagnosis by any chance? Like that you may not be actually seeing endometriosis because you're on the pill from a young age or something like that.
So I would imagine it would be more difficult on ultrasound to see it because there's no flare-ups. The hormones would definitely have an impact. Going back to the progestins, though, so a girl might be prescribed like a depot shot, like an injection, or they might take a progesterone-only pill. There are various different forms that one could consider, but then sometimes that also doesn't work, right? So then the third approach, the step up, which is typically specialist initiated, so like a gynae, might prescribe what's called a gonadotropin releasing hormone, a GnRH antagonist, right? And this basically acts on the brain. So it stimulates the pituitary in the brain to shut down the axis to speak to the ovaries and then shut it down, essentially. And then this triggers a severe hypoestrogen state. So really like shuts down that estrogen production. But you can only imagine how bad the side effects might be, right? It almost like mimics menopause, hot flashes, dry vagina. So those are like the two very common ones: disturbed sleep, mood disturbances. So the medical management is fantastic. And if it works, it works. If you can get it right at the baseline level, anti-inflammatories, hormonal pill, boom, like you're good to go. But, as you go up and up and up, the side effects may become more and more severe. And you really have to weigh up the advantages and disadvantages of medical management, because the disadvantage is that, well, the step up then is surgery. Who wants surgery? I mean, that is quite intense. I think that's very intense. And it's invasive. But some girls have no choice.
It doesn't always work, right?
Yeah, exactly. I mean, look, it would help. I mean, it doesn't always work in that if the endometrial tissue is detected intra-op, biopsied, and then cut out, right, it can actually still regrow. So people don't even talk about that. In fact, I could say with confidence that it will regrow, but it's just that once it's cut out, you're almost like starting from baseline again, and you can like shut down everything with hormones and slow its progression to growing and flaring up again. So in that regard, it may confer some benefit. But if you could avoid surgery, I would say that would be ideal. But yeah, the medical management certainly does come with its advantages and its disadvantages, and girls must always be counseled on that. You mentioned diet, though.
Diet, yes.
Shall we get into that?
Exercise. I mean, it is an inflammatory disease, right? So I know we've spoken about other inflammatory disorders like PCOS and how important strength training, which I know is your absolute passion. But
yeah.
Strength resistance training, diet, anti-inflammatory diets.
Yeah. So because it is an inflammatory condition, the thinking is that one should adopt an anti-inflammatory diet, right? And generally, I would advocate for that because I think it's just better. It's good for one's overall health, to, kind of stick to a clean Mediterranean diet, high in, fruits and vegetables, healthy starches. So that I would always advocate for it in general. But when it comes to endometriosis and you're looking at the science does not currently stipulate any dietary recommendations for prevention or treatment of endometriosis. So one study did report a slightly lower risk of developing endometriosis when one was consuming a higher intake of green vegetables and fruits, which, I mean, for reasons that I mentioned earlier, that kind of makes sense, right? And then there was also an increased risk of developing endometriosis with an increased intake of beef and other red meats or ham. But I mean, the science hasn't caught up yet. So when it comes to vitamins, interventions that have been associated with some reduction in dysmenorrhea, so painful periods, includes micronutrients like vitamins, including vitamin E, vitamin B1, B6, fish oil as well, a large dose of vitamin D3, typically 300,000 international units, given 5 days prior to the expected first day of the menstruation, and then ginger powder on days 1 to 3 of the menstrual cycle, at a dose of 250 to 2,000 milligrams. That's something else a girl can try. And then dietary zinc supplementation, which may provide small reductions in pain of primary dysmenorrhea, but again, I have to caveat this and say the available studies are limiting, and only a small clinically relevant improvement has been reported. And also, I just want to emphasize that those vitamins, that's specific to dysmenorrhea, which is a symptom of endometriosis. It's not specific to endometriosis itself, right? This is just for any girl with bad period pains.
So tell me about exercise.
Okay.
Cover diet, supplements, exercise. What can and can't be done? Is there any proven exercise that supports women with endometriosis?
If we speak about dysmenorrhea, one of the commonly reported symptoms, exercise has been shown to play a very valuable role. But there's no specific recommendations with regard to which type of exercise, the optimal time, duration, frequency. So moving your body is good. Having said that, I mean, if you're crippled over with pain, I mean, please don't exercise. I mean, I can't imagine one would want to. But if you feel like you've got a bit of a niggle and you feel fit to exercise, I would suggest you do so, because it can moderately reduce the pain.
If you're having cramping and everything, and that is caused by, I don't know, like contractions or something like that, or you're having that, wouldn't actually like also doing ab work maybe add additional pain because your muscles are more tense and that creates further sensitivity maybe to these cramps?
So basically the cramps all result from the vasoconstriction, right? The tightening of the vessels. And I would imagine if one is exercising, you can actually further help stimulate blood flow, open up the vessels. So I actually think it's the opposite. Exercise in general definitely is beneficial. And then heat, for a similar reason to what I was alluding to earlier, heat also is a vasodilator. It helps open up everything. So open up the vessels and improve pain. So there are limited studies looking at like putting a heat pack around the abdomen. Does it help? Basically, it does help, but it helps as much as an anti-inflammatory would. So it's not going to like confer any added benefit. So yeah. But then there are other modalities that we could quickly touch on that is non-medical, right? And not diet or exercise related. And these are your complementary medicines like acupuncture. Yes. Acupuncture. And then I also explored pelvic floor therapy. So let's just touch on pelvic floor. So a lot of patients with endometriosis have pelvic floor spasms. It's just associated with it. This is for those patients with endometriosis who have the endometrial tissue lying deep in the pelvic cavity. So they just spasm a lot. So basically, for these kind of patients, pelvic floor training is very beneficial and it helps relax the muscles. It stimulates blood flow to the muscles. It helps ease the pain. So definitely might be worthwhile looking into if you are a patient who resonates with the symptoms. And then acupuncture has been widely studied, but the studies are very low quality, which is very sad. So it's kind of like a watch the space kind of a thing. Again, it's not implemented in the endometriosis guidelines. I can't come forward on this platform and say, oh, get acupuncture and you'll be sorted. No, I'm very much in favor of the medical model. But if you feel like acupuncture is something that could work for you, it might be something worthy of exploring. I actually read up that like for endometriosis, they put it behind the ear, auricular, which I mean, I don't really understand.
Pressure points. Yeah, you've got the different pressure points in your body. Imagine it's a great adjunct, right? That is recommended. And I think also from pain management standpoint, acupuncture is meant to really be able to support. So maybe it's also that it supports with the pain management.
Yeah, quite possibly. Maybe it's worth a try. Maybe the science will catch up and actually prove that it really does have benefit. But for now, I would say rather consult a doctor. Don't just rely on acupuncture alone.
How can we better support women with endometriosis? Are there support groups? What support is out there if you have endometriosis? And also if you don't have endometriosis, how can you better support your friends? How can you better support your coworkers? You know, I appreciate as we've discussed previously, like there are law changes that are happening where maybe certain countries, I think it was Spain, if I'm not mistaken, was also starting to recognize that women can take time off work with endometriosis due to the pain. What should we be aware of? What should we be thinking about?
I think you touched on it, Em. I mean, supporting someone with endometriosis means going beyond sympathy. It's about providing empathy, advocacy, so spreading awareness and providing practical help. So yes, if that means assisting in the workspace, not just like shaming a colleague who is suffering for her symptoms. Also, encouraging a partner, if you're in a relationship or you have a friend who's suffering from the symptoms that we alluded to earlier, you encourage her to go and consult a healthcare professional, basically to empower her to know her symptoms and go seek professional medical help, because it is available. If you're also similarly a partner and your partner is experiencing problems with intimacy, just be compassionate, understanding, know that there could be an underlying medical problem. What do you think, Em? Like, what are some ideas that you have?
I think from a workplace perspective, I think it's facilitating an environment that feels kind of safe for a woman to be able to speak up and also share what she's going through, so that, you know, if she does need time of work, or, you know, that you're understanding. You can't make someone who's in crippling pain, if that is the experience that she's going through, or otherwise fertility issues or whatever that may be, have to sit through kind of meetings and stuff like that. Obviously there has to be a balance, obviously there has to be but really I'm trying to understand what that person is doing and creating an environment in the workplace to allow that openness and an understanding of what a person is dealing with, you know, in the same way that we do with migraines or other diseases or disorders. I think that's hugely important. I think what you also touched on from a partner perspective or a friend perspective, I think probably also not, like, as you said, like, don't gaslight, don't diminish the pain that that person is going through as just like, oh, just period cramps or something like that. Like, it's, and I think there's a huge psychological impact also, right, from the hormones and fertility, chronic pain. So I think it's something to take very seriously and very sensitively. And I think, you know, just to provide that support.
Yeah. And just to actually expand on that, I have a favorite patient, no jokes. I don't have any favorite patients. I love them all, but there is a patient who has really stood out for me this month. And I actually told her that I was going to be chatting with you tonight. She is a listener, so I know she's listening in. And I told her I'd like mention her case because it is unique, but it kind of touches on all these things that we're saying. But essentially, she came in with an unrelated complaint, but it was on examination, I detected a very large abdominal mass, for which she actually had surgery 2 weeks ago. To take out the mass. It was huge. And then when the surgeons looked in her abdomen, took out the mass, they actually told her that they suspect that this is endometriosis. But this just goes to show that she'd been living with this for years. And when she came to tell me about the operative findings, I was like, I just said to her, but like, did you experience these symptoms? And she's like, yes, all these years, like I'd been experiencing them. I just thought it was normal. And this is where we ended up. So it's like, it's absolutely crazy. Thank God she's okay. Everything's fine. But the point being that, yeah, girls are very, very, they're disempowered. They don't think that their symptoms actually might mean something. And I think this episode really just serves as a reminder that, please take your symptoms seriously. If you're concerned, consult.
And if your patient is listening in, then just a huge thank you for sharing that story, and just so sorry for everything that you've been through.
Yeah.
I think we have covered so much today. Just to kind of wrap up, endometriosis, from my understanding, and I'm definitely not going to do it justice here, endometriosis, the endometrial tissue basically moves and kind of lodges elsewhere outside of the cavity. That can cause blockages within the fallopian tubes. That can also, though, migrate elsewhere in the body. It can cause pelvic disorders. The most commonly known symptom of endometriosis is extreme painful cramps and periods, but there are a host of other symptoms, and some people are asymptomatic. We spoke about how it's diagnosed and why it's misdiagnosed, because a lot of people don't represent the symptoms. They either downplay the symptoms, or it's not picked up on a screening because it's elsewhere in the body. So many things, but there are tests available. We spoke about the potential impact that it could have on fertility, and South Africa, definitely look into your egg freezing. Other countries are ahead of you on that one. So
Amen.
Get it together, South Africa. And then treatments. We spoke about the pill, spoke about injections, diet.
There's so many
exercise.
Treatments.
So much out there. The flare-ups as a result of the rising fluctuations of estrogen. Most importantly, though, is if you believe that you have endometriosis, or even if you have an abnormal period or anything of the sort, if you are concerned, as you said, consult. I really like that. So definitely. And if you are listening in and you believe that one of your loved ones is suffering from this, be empathetic and definitely try and encourage them to get support and help. But thank you so much for listening in to the Ovarian Club. It's been a privilege to be here today. Don't forget to follow us on Instagram at the Ovarian Club. We really would love to hear from you. Love to hear what you think about the episode, any other questions you have. So yeah, please do hit follow and subscribe on whichever streaming platform you're listening to us today. And thank you.
Thanks so much. It was so awesome shedding light on this important topic, and looking forward to chatting about others very soon. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. See you soon, follicle friends.